Well, good afternoon, everyone. My name is Jennifer Cook. I'm director of the Africa program here at CSIS. It's wonderful to see you here on a very gray, damp afternoon. But it is, after all, an event on Nigeria and on the very important issue of maternal health. So I want to welcome you all. I don't know if Ambassador Adefuye is here. I'll put my glasses. He should be coming, so I want to welcome him. And especially to our distinguished speakers, who I will introduce in just a moment. The issue of maternal health has been gaining much needed profile and global health policy attention in the last several years. Here in the U.S., U.S. Secretary of State Hillary Clinton has, together with USAID, have elevated the issue as a component of U.S. global health policy. The UN institutions, the African Union, the G8, the Gates Foundation, and many others have all added to the momentum in the fight to curb maternal mortality. Here at CSIS, Janet Fleischman and Phil Nyberg, who are senior associates of our global health program, have been writing on this issue for many years. And now, as the Millennium Development Goals target date of 2015 approaches, that's added a sense of urgency among governments and the international agencies to try to meet those targets outlined in the MDG maternal health goal. And in reaching the MDG goal, Nigeria is going to be pivotal. In 2010, an estimated 40,000 Nigerian women died in childbirth, and the country accounts for an estimated 14% of maternal deaths worldwide. Pretty phenomenal numbers. But despite these bleak national statistics, there are some signs of growing opportunity in Nigeria. In the last few years, the federal government has devoted far greater policy attention and resources to maternal health than previously, and a handful of state governments have really are beginning to tackle the challenge in a much more strategic and comprehensive way. So my colleague Farha Tahir, who also helped put this together, and I traveled to Nigeria this summer to better understand the big picture on the country's national strategy on maternal health, but also to get a sense of the challenges at the state and local government level, which is really where the rubber hits the road on so many of these health and service delivery issues. But in particular, we wanted to look at and examine instances where real progress is being made. And we visited Ondo State. We had heard about this, and I'll explain how we heard about it in a moment. But in Ondo State, the government's Abiye initiative has won a lot of praise, both from maternal health experts, both in Nigeria and beyond, as a program that's kind of homegrown, that's adopted to the local context, and that's putting into practice many of the things we know we should do on maternal health, but just aren't getting done. And so it's an effort to build this comprehensive, sustainable, and very importantly, I think, evidence-driven approach that ensures that women get access to reliable maternal health services and quality health services. There's always been a big focus on the challenges in a lot of the literature on maternal health. But we think that to generate and sustain momentum on maternal health, it's going to be equally important to identify and support instances where progress is being made. Successful models can serve as an encouragement to policymakers and health implementers. It can offer practical examples of what is possible in a local context. And perhaps most important, over the long term, is to create an expectation among citizens that they deserve this, citizens, communities, and civil society, that they deserve this, that this is possible, and that they can demand better from their government, whether it's the local, state, or federal government, so that it strengthens constituencies for maternal health, and more broadly for service delivery and ultimately governance. Maternal health is one of those issues that gives you such insight into the governance structure and the incentives and who matters in policy making. And that it's interesting. I'm not a public health expert per se, but from a governance point of view, it offers a great prism to look at that. So in this vein, I want to give a very warm welcome to Governor Olusegun Mimiko, who's executive governor of Ondo State. He's really the architect and the brain and the driver of the Abiye model, although he has a great team with him who has helped him in that. He's a medical doctor by training. He's twice served as health commissioner of Ondo State. He's demonstrated through his work as a political activist, a doctor, and health commissioner, a long-standing commitment to delivering services to the very poor and marginalized and to maternal health. Governor Mimiko represents one of Nigeria's smaller parties, the Labour Party. He won. He won an election by a wide margin in October 2012, up against a very organized, fairly organized and well-resourced opposition, I have to say, as well, and is therefore able to follow through on the Abiye expansion of the Abiye model, which he launched when he first entered office. With the governor is an Ondo State delegation. I'm not sure I can name all of them, but I would like to welcome them. And Farha and I received such a warm welcome from the Ondo government when we were there. And in particular, I'd like to recognize Remy Douele, Senior Special Assistant for International Relations and Diaspora Affairs. Thank you, Remy. Remy really got this whole thing started. She came to CSIS talking about what was happening in Ondo State, in agriculture, in business creation, in health, and the health issue really piqued our interest. She helped us travel to Ondo and help get us in touch with appropriate people. So, Remy, thanks so much for that. You've really been such a great partner on this. Dr. Dayo Adeyanju, Commissioner of Health, is here. And Dr. Lawal Oyene, is he here? Yes, you are. Okay, welcome. We didn't see you come in. Who is running is chief medical doctor at the Akure Mother and Child Hospital, which is a very impressive outfit, and this is a very impressive leader of that hospital. And thank you also for being so hospitable. And I apologize for this long-winded introduction. But I want to introduce also Dinesh Nair, who is until recently Senior Health Specialist for the World Bank in Nigeria. There he launched and oversaw the bank's results-based financing pilot program in Nigeria that is in a couple of states that he's going to talk about. This works to kind of incentivize health service at the local government level, which is much needed and kind of a vexing problem going back some time on a whole bunch of issues. And then Murtala Mai, who's former country director for Nigeria for Pathfinder International, which is the big programmatic operator within Nigeria, doing fantastic things throughout the country, particularly in the north. He's now in Washington, fortunately, Senior Technical Advisor for Best Practices and Community Services at Pathfinder. So Murtala is going to help us situate the Ondo program within the broader challenges of maternal health in Nigeria and talk a little bit about that. So welcome to all of you. Welcome, Governor, and the floor is yours, and we'll leave plenty of time for questions and comments.